gentlemen, and thank you, Dr. Zhang and Dr. Che, for your informative introduction. Again, it's a privilege and pleasure to have this opportunity to share this response that we were implemented in our hospital. And hopefully, the effectiveness of this action will be beneficial to you. And some of our participants have already sent their questions by emails beforehand. And among these questions, I throw out some to my colleague, Dr. Che, and he will answer those medical affairs related questions. For questions regarding government policy, maybe I'll leave them to Director General Vincent Yao. I believe he can give us more details. Here, I would like to answer one of the questions about what we consider to be important aspect of the epidemic prevention that contributed to the success of Taiwan's fight against this COVID-19 pandemic. Okay, I actually have a very simple one picture slide, but maybe you can see later. As you may notice, after the previous introduction, Taiwan government and our hospital share the same principles in facing COVID-19 pandemic. Okay, we see the slide. We have followed the three principles: fast, fair, and transparency. Based on the lesson we have learned from our SARS experience in 2003, at that time, Taiwan was among the worst hit territories. Taiwan government established a public health response mechanism for enabling rapid action for the next crisis. Therefore, precautions to contain the spread of the virus, of this coronavirus, were taken quickly. In our hospital, no sooner had we got the message, we rerouted our patient flow, set up temperature monitor system, TOCT checkpoint, outdoor examination counter, and activate isolation ward. We got ahead of others. The second principle is fair. Our national health insurance system promises and provided fair medical treatment in every citizen in Taiwan. In the beginning of this epidemic, our government took over the mask production line and implemented the mask rationing plan, which gave people an equal amount of masks to prevent stockpiling. People got protected by this mask and thus feel less panic. In hospital level, soon after we had inventoried our epidemic prevention materials, we set a very clear PEE policy according to the risk of the coronavirus exposure in their working environment. Under this guideline and the surveillance of every department's leaders, every hospital staff is involved in this battle and properly equipped. And the third principle is transparency. Routine press conference hosted every day by the Central Epidemic Command Center give an update to the current status of COVID-19 and open the floor for questions. Over these few months, it has become the most popular lead broadcast in Taiwan, and some people consider this to be the nourish for their mind during this period. There's also a direct phone line for instruction if people have any related question. In our hospital level, we hold a similar routine leadership meeting quickly for intra-hospital communication and decision making. The conclusion of the meeting will be revealed in our hospital intranet for reference and open to every hospital staff. All information thus become very transparent. I think these three principles help strengthen the trust either between hospital and our patient or hospital and between the government. In addition, we are lucky to have a very strong backup from our community, along with many digital social innovations. And altogether, we can contain the spread of the virus and minimize the damage. And now I'll leave some time to my colleague, Dr. Che, for answering other medical affairs related questions.
Okay, so first there were some questions that were emailed in with the RSVPs beforehand. Now, for isolation protocols, Dr. Young actually mentioned that before. Positive patients are treated in negative pressure isolation rooms to fully treated. So any patients that has been positively diagnosed, they were completely treated. They were not sent back home or to have home treatment or anything. They were in negative pressure isolation rooms until completely treated. All patients that were in close contact were mandated for a 14-day home isolation. Travelers returning from high-risk areas, now that has been expanded to the whole world, are mandated to a 14-day home quarantine. Now, this is especially for Guam Memorial Hospital, which Taiwan Advanced Hospital has a close relationship. We haven't been working right now together during this pandemic, but I think that we could have conferences like this, but from medical personnel to medical personnel. That means our infectious disease specialist, Vice President Young, or our radiology, our Department of Radiology could help in conferences talking about how to correctly diagnose or quarantine these patients. So maybe information sharing would be most important in our relationship during this pandemic. Now, if someone has a high fever, what steps are taken to promote, to diagnose COVID-19 and prevent further spread? So right now, anyone who is clinically suspected, they are tested and then according to their condition, isolated at a negative pressure room or at home. Which particular populations are most recommended to have a diagnostic test? That's people with positive TOCC, travel, occupation, contacting cluster. The kind of tests we use are RT-PCR. Have we seen a recurrence of COVID-19 in anyone who's previously recovered? Currently in Taiwan, no. All recovered patients are still under close follow-up by the government, and we haven't seen a recurrence in any one of them. Do you have any current usage of serology tests? So serology tests to determine immunity, that's something that's still in debate, and in our hospital currently that is not used. The prevalence rate of hospital staff for COVID-19 infection, very fortunately right now, is 0. As I said, serology test right now is still in debate. All patients in our hospital that are for COVID-19 is checked with RT-PCR. Now, our hospital staff do not undergo routine COVID-19 tests, but if they have any symptoms, we will then test them. All elective procedures in our hospital right now are being performed as usual. But due to the pandemic, there are patients who choose not to come to the hospital, not to have their elective surgeries recently, and we respect their decision. So there has been a minor decrease of elective surgeries in our hospital right now, but according to our current condition, we've actually seen a resurgence in patients who are coming to the hospital for elective procedures. Knowing what we know now, what would we have done differently? Now, that is a very good question. As I said, this is a very, very fast-moving disease. So even though we are saying that we did have a fast response, even faster response would have been even better. So active faster at every step. Travel restrictions on hospital staff were about 2 weeks too late. We have had doctors, even though we told them it would be best not to, travel in all around the world during February. Coming back, that posed as a threat to our hospital. Luckily, they were not infected. As I said, we had phase 1, phase 2 of the COVID ward. The day after the phase 2 COVID ward was set up, it was the day afterwards. It was at full capacity. So that means that if we moved faster, we could have treated even more patients. And we could have rented better tests for the COVID screening. We could have considered container houses or prefab buildings. But due to the long-lasting situation, that seems that this might become, not might, will become. Now, the value of wearing non-surgical masks for general population, that also needs medical literature to confirm, but it seems like to prevent droplet spray. So preventing droplet spray could help prevent COVID-19 infections. The role of testing and screening in controlling the spread of COVID-19 in Taiwan, that has been incredibly important. So as I said, any patient who has been tested positive are kept in hospital in negative pressure rooms. That means that they are not outside in the community. That means that they are not outside spreading the disease. Controls used in public buildings, almost all buildings right now in Taipei have to have your temperature checked. If you have any symptoms, coughing, sneezing, they most likely won't let you in. But since we know that asymptomatic transmission has been proved, those controls might not be that effective, but better something than nothing. Right now, all our schools and businesses are open. We're actually waiting for a first wave. So we have mostly kept this virus outside of our borders. If it comes within our borders, then there will be different implementations of control. The capacity of the health systems in Taiwan, I think that the single payer universal health care actually has helped Taiwan quite a lot in this pandemic. So all patients who have symptoms, they do not have to worry about payment, co-payments, insurance, things like that. They can come to hospitals to receive testing and treatment. So this might be something that's important. And also, since healthcare in Taiwan is relatively very cheap, we have very high capacity in hospitals, in clinics all around the world. We have the largest density of da Vinci surgical systems in the world. That means that if all our hospitals stopped doing their non-COVID duties and completely focused on COVID-19, we would have a very strong medical force to lean on. The Taiwan society, this is a very common misconception. The world seems to think that all our phones are tracked by digital tracking. Digital tracking is only for patients under government mandated quarantine or isolation. And it is not a very accurate tracking. It is that since you're at home, you should be using the same cell tower that gives you service. If I live in Taipei and suddenly my phone shows up in Kaohsiung with a cell tower that is 100 miles away, that means that I'm out of my house moving around. That is the only kind of cell phone tracking that is done in Taiwan. So it is not an authoritarian tracking such as China. Specific government policies and memorials as historic memories. Well, SARS, as I said, had a very severe impact on our society and also on our healthcare society. So the Taiwanese society probably is more trusting to the government because they know what would happen if a pandemic breaks out within the country. So right from the beginning, all the government needed to do is to say, everybody needs to be careful or there might be another SARS. So then the society would be more accepting and trusting. And for government policies such as down to the basics, even medical education has changed because of our experience with the SARS epidemic. Those were the questions that were already sent to us, and during the chat, there's also some questions that I can try to answer right now. Regarding border control in Guam, Guam actually is quite lucky to be also like Taiwan, an island that is easily to be isolated. So that means border control is actually very important. If it's possible to keep the disease, the virus off island, that would be the most simplest way. So maybe, if possible, a mandatory 14-day quarantine, home quarantine, or for 14 days for any arrivals on the island. But I think there will need to be a law to support such a mandatory quarantine. Preventing public panic, I think most importantly would be to help have transparent information. Passengers coming from outside the countries, as I said, 14 days of quarantine. During the quarantine, there is a daily phone call. If you do not pick up the phone within, I think, 2 calls or 3 calls, then the local police will be at your front door asking why you're not picking up the phone. We actually had a very warm story about a foreign traveler who was under mandatory quarantine. His phone was broken. He was unable to charge his phone, so he was unable to pick up his phone. And then when the authorities understood his problem, they, I think, gave him or lent him a smartphone during the quarantine. Predictions right now, since there's so few cases in Taiwan, virtually no community spread, so there's not a lot of predictions for Taiwan's condition. For Taiwan's reopening strategy plan, that's not something I, as an administrator in the hospital, could be able to answer, but that is very, very hard. Right now inside Taiwan, there's no closure. All businesses and schools are open as usual, but the borders are closed to non-residents and the non-citizens. And that's something that will be needed to be opened up sooner or later. Contact tracing has been very important. Maybe about, I don't know the correct number, about 30% of patients, positive tested patients, were found by contact tracing. So family members of patients who were positively diagnosed, then through contact tracing, we found them, friends, colleagues, we found them, schoolmates. By finding these patients through contact tracing, it prevented spread in the community. Yes, there has been a growth of telehealth in Taiwan, so they made a very fast law about allowing looser regulations on telehealth, helping patients, chronic patients, not come into the hospital to receive their regular medication. Yes.
There's some question and it's newly coming, so maybe answer it first.
Sure.
They talk they ask about the mathematical models or formula we use in Taiwan. Actually, I cannot answer this question. This is the level about the CBCC. Another question about can Taiwan form travel bubble strategies with low risk community like one to lower or to separate living quarters away from family or community at large. I think we have very good equipment for every co-worker who take care of COVID patient. So their equipment is enough, and also given the location different and independent location. They want to stay in hospital or if they want to go home, they can make their choice. But actually, so far, we have any staff get infected because of caring patient. So Also, what is your protocol for incoming traveler? I think Dr. Chen has already answered the question. We are not close the national border. Everyone come to our country is obligated to have a 14 days quarantine. And thereafter, you can do anything or go anywhere.
Can I also answer some of the questions related to government policy? I think as you are all aware that our CDC, Taiwan CDC, reported the first possible transmission of coronavirus as early as December 31, 2019. So our government adopted a very quick response to this possible pandemic. So on January 20, Taiwan already activated the Central Epidemic Command Center, or CECC. I think CECC plays a very important role to reach to communicate with the general public, and then we build trust among the government and the general public. Particularly the daily press conference conducted by CECC provides a lot of information and transparency of the pandemic to the society. And I think there's some questions related to how Taiwanese society is more accepting and trusting of the Taiwan government's response to COVID-19. I think in addition to this daily press conference, the high tech is not only the high tech is applied to the tracing of the possible patients, not only restrict, of course, in some certain aspect, it restrict people's freedom, but it also helps to build the trust of the people who are not infected by the disease. And according to a public survey, the majority of the general public, I'm talking about 80% of the general public, has trust and approval for this government adopting this type of measures. And our president's approval rating is now over 70% for her capability of containing this pandemic in Taiwan. I think overall speaking, the impact of SARS in 2003 was enormous. So not only the government, but the general public understands that it is very important for the government to take very assertive measures to maintain a security and safe of the entire society. And there's also another question related to when did Taiwan close to non-citizens, and did Taiwan already reopened to non-citizens or non-residents? The government actually barred all foreigners, all foreign nationals from entering Taiwan on March 19. And on March, I remember on March 24, we even barred transit passengers from entering Taiwan. But Taiwan is very lucky because Taiwan is an island nation, so it's easier for us to do isolation. But I think currently the CECC believes that we need to maintain this type of isolation for a while to see if we are able to reopen our border to foreigners. I think I mentioned that in January we activated CECC, and later on the Executive Yuan declared that the national alert for coronavirus was lifted to level 1, and CECC plays an even more important role from that time on. It becomes a whole of government approach to coordinate interagency efforts. So every day at CECC, we have representatives from different government agencies to be present in the meeting and to coordinate with each other to see if we have if we need to adopt the new measures or if we need to relax some sort of restrictions. So as the other doctors mentioned, this is a rolling situation. The CECC will evaluate all different type of situation every day and to make decisions. And I think these are the most government regulation related questions.
Okay, thank you. And there's a new question, maybe I can answer it now. How important is the mask rationing plan before and during the pandemic in your experience? I think from the experience of SARS, Taiwan people learned the mask did help them and keep them from other infection. And in fact, during this period, we also noticed that the case number of influenza and herpes dramatically decreased when every people wearing a mask. So a fair mask rationing plan is very important and help to calm the patient down so they will less panic. And also government funded mask, yes, and current the prices for each mask is about 5 new Taiwan dollar. And previous that was 2, but every person in Taiwan accept all the price. And also, does the national health system pay provider if patient visit decline and hospital and physician experience financial distress during the COVID-19? Yes, we did experience a very big financial distress during this epidemic. But however, the government promised another financial assistance. Due to the previous experience, I think we can count on our government. Another question is about, we mentioned Taiwan has been preparing for 17 years with preparedness plan. Do you train yearly? Actually, we have incorporating the pandemic crisis management in our periodic hospital accreditation. So every hospital or every physician is very familiar with how to respond to the sudden onset of the epidemic crisis. So we get use of that. Dr. Che, do you have any comment?
There's one more question related to government policy. That is, before reopening our schools and business, what needs to be done to protect us from a second wave of the virus? I think there are 3 things needs to be done. That is, to make sure there's no community transmission. I think in Taiwan, we don't have community transmission for over 3 weeks. And I think that's the first criteria we need to apply. And secondly, face masks needs to be distributed. In Taiwan, we have a very sound and good system to distribute masks to the general public. Now, I think we have enough masks for the general public to an extent that our general public started to donate their masks. The masks they don't need to the world. As yesterday, we have a donation of 4 million pieces of masks from the general public to the world. And thirdly, I think social distancing has to be applied. Now in Taiwan, not only in schools, but in business such as department stores, in restaurants, social distancing have been applied by the owners of this business. That will provide a safer environment for the consumers to go to. I think these are the 3 measures that need to be done before reopening business. Thanks.
And also a question, a very important question for hospitals. Does the national health system pay providers if patient visits decline? Have hospitals and physicians experienced financial distress during COVID-19? Our government has a very delicate relationship for the national health system between hospitals. The national health insurance system did promise that they will reimburse hospitals at a higher rate due to declined patients and also the higher burden of the pandemic. And yes, hospitals and physicians have experienced financial stress because we have more implications. We need to have more security and safety measures. And also we need extra bonuses for the doctors on the front line. But it seems that the government has a plan for that to help all the hospitals, the people on the front line to be able to go to the front line without any concerns of financial problems. Can Taiwan from travel bubble strategies with low-risk communities like Guam to allow for resumption of medical referrals to Taiwan medical centers? Actually, that is something that since the Taiwan Adventist Hospital has been treating international patients from around the world, I think with the help of the foreign ministry, we can arrange medical referrals from the Pacific region, such as Guam, to our hospital for treatment.
Yeah, for some urgent cases, we can still arrange that. But of course, now since we have already barred all foreign nationals from entering Taiwan, but that doesn't mean that we have barred any type of entrance of foreign nationals to Taiwan. If you have urgent matters, or if you come to Taiwan for business, you can get a special permit from our overseas offices. For example, Taipei Economic and Cultural Office in different cities in the United States. You can still get special permits to enter Taiwan. However, when you enter Taiwan, upon your arrival, you have to go through the quarantine procedures. That means that 14 days of quarantine.
So especially for Guam, the northern, for Saipan, I think that since Taiwan Adventist Hospital already has a lot of relationships with them, if there was that urgent need for transfer to Taiwan for treatment, you could contact our regular point of contact, Sabrina, and then we will contact the Ministry of Foreign Affairs to see if we could get a special visa due to urgent medical situation, and then come to our hospital to receive quarantine and treatment.
Of course, this type of application also has to get approval from CECC.
Yeah, which is in charge of the whole thing in Taiwan. Right. What they say counts.
Now, our Minister of Health is his status of authority is above every other ministers.
I think the current capacity of our health system is available for anyone who wants to receive the help from Taiwan.
Okay, I think we have 10 more minutes left. Do you want to open the floor to questions through video conference?
Sure. Anyone who wants to ask a question through a video conference could turn on their microphone and ask, and we can have a conversation.
Oh, hello. It's Toronto City Councilor Mike Cole. I want to thank the health officials, Adventist Hospital, and all the excellent presentations here. We're here up in Toronto in Canada, where we have a significant outbreak that we're managing. It's very helpful to see what you've done to succeed. And thank you so much for sharing your expertise with us that we will share with our colleagues here in Toronto and in Canada. So again, continued good luck, and your Taiwan model is of great help for all of us, and we will share that here in Canada. Thank you so much from Toronto.
Thank you.
Yeah, thank you very much.
You're so welcome.
I see there's a question on the writing board mentioned about Taiwan. Many manufacture our own mask. Yes, we have a national mask team who have a very huge production, about 1,000.
Because Taiwan is very strong in our precision machine tool industry. So that provides a basis for the government to transform some of the industry to a production line for manufacturing face masks. So the government is able to produce the masks from just several million pieces a day to now 18 million pieces per day.
Yes, before the pandemic, Taiwan was a country that was relied on imports for surgical masks. And then as soon as we started to notice the pandemic, the government had a quick action and called for our precision machine tool industry to start making the machines to make masks. Now we have 60 new factory lines that are making the surgical masks here in Taiwan. That's why we also have the capacity for our own country and also to donate around the world for those in need.
And I think this is an effort not only made by the government, but also by the private sectors, by the entire general public, because the government's efforts got the support from the general public. And the private sector also work very closely with the government. In the beginning, we don't have enough experienced staff to monitor the manufacturing of masks. But the private sector is very kind enough to train their staff to be able to monitor all the manufacturing, and they work tirelessly, and they also work over hours to get this production line done.
Governor Torres, I see you're still online. Do you have a question you want to ask?
Or something to share?
No, I just wanted to say thank you very much for everything, and I want to again congratulate Taiwan for their effort and everything that we have implemented for your people. And I also want to say thank you for allowing us to be part of the webinar, and I hope to have a stronger communication and working relationship, and also moving forward. And I welcome Taiwan and the hospital also to come to CNMI and see how we can partner up even after the COVID. Thank you.
Thank you. Any other participants who wish to ask a question, you can open your mic. If there is no more other questions, then I will announce that the seminar now concludes. Thank you all for joining us. We wish you had a fruitful meeting, and please do feel free to contact our embassy or offices in your relevant jurisdictions for further information. We will send out the PowerPoints through emails to all the participants who participate today.
In PDF format.
In PDF format. Thank you. Have a good day. And President, do you want to say a few words? Concluding.
Okay, thank you for joining us. So I will give you the final thought regarding the battle for COVID-19. I think there's no one strategy fit all, but I like to give you a tips. The number one is transparent information. And the second is trust each other. And the third is abide by the government PMP, the policy and procedure, such as keep a social distance and wearing the face mask on crowded occasion and hand hygiene. And we are willing to answer the all question, institution to institution via video conference anytime. And On the other hand, we have a comprehensive risk management protocol, such as you know, as every year there are so many earthquake, typhoon, and flooding, and the emerging contagious disease hit Taiwan. So we have very comprehensive risk management protocol to share with you. So if you are interested in the risk management, you are most welcome to contact us. So we are happy to share with you. So we expect health for all. Thank you for your attendance. Thank you. May God bless you.
All right. Thank you very much to all the participants and all our speakers. This concludes the seminar. Thank you.
Thank you. Thank you very much.